Hey guys, thanks for tuning in to my latest video. So today I am going to talk about my gallbladder removal. So this is my story. It was about a year ago that I started having some stomach cramps, some digestive issues. Nothing terrible, but I could tell something just wasn't quite right. So I went to my doctor and kind of just said it was a virus or something going around. Gave me some medicine. Medicine helped. That medicine is actually called dicyclamine. I believe it's also referred to as Bentyl, and that kind of helps slow things down and paralyze the digestive tract, something along those lines. So that medicine did help with the stomach cramping. So if I had any of these flare-ups, that medicine would definitely help. But I was not getting to the root of the problem. So I went to a GI doctor and they basically said, IBS, something along those lines. But they wanted to refer me to get a CT scan. So that's what I did. I got a CT scan. Well, they didn't see any issues. There was nothing present that would indicate why I was having these symptoms. But they did see a polyp on my gallbladder. It was a 1.1 centimeter polyp. And they said once these polyps get to 1 centimeter or larger, well, that's when they become the risk of becoming cancer. So I was told, you got to have your gallbladder out. So about 5 weeks ago, just a couple days shy of 5 weeks ago, I had my gallbladder removed. And watching all the videos on the internet, of course, and talking to friends and family, I couldn't believe how common it is to have your gallbladder taken out. And there were a lot of stories, good and bad about the whole process, and it kind of scared me and worried me. So I wanted to give you my story real quick and let you know that it's actually not too bad. So, like I said, it was about 5 weeks ago. I went in, had an early morning appointment, got there at, I think it was about 6:30, 7 o'clock in the morning, and they prep you, of course. Now, I was really nervous. I had anxiety. I didn't know what to expect. But I can tell you, right before they took me back, they gave me something called Versed, which it's kind of like a little chill out medication, I guess. And it calmed me down dramatically. So not that I was going crazy or anything, but of course you're anxious as you're about to have something like this done. So they put some Versed in my IV, which was in my hand, and as soon as that medication hit me, I started getting really, really calm, started getting sleepy, and of course this is before they roll you back to the operating room, so that was great. So this was just before they took me back, and that really calmed my nerves. I can remember being taken into the operating room, but I don't really remember much else. I don't remember the propofol going in. I don't remember much of anything at that point. I believe they gave me another dose of Versed once I got on the operating room table. And that pretty much sealed the deal. Don't remember anything. So if you're nervous about, going into the operating room, if you're nervous about falling asleep under anesthesia, getting that Versed ahead of time really helps you calm things down and not be so worried and don't even remember a lot of it. So of course there's no memory of the surgery at all. I was out. I was under propofol, under complete anesthesia. So when I woke up after the surgery, which I think was maybe 45 minutes for the actual procedure, when I woke up in the recovery room, I of course I was out of it, and I was nauseous, so they gave me something to drink, gave me some crackers and Jello, which did help. And I left probably an hour later and went home. Now, once I got home, I can tell you the first 3 days were pretty rough as far as the abdominal pain. They stuck 5 holes laparoscopically into my abdominal area. And of course, that damages all those muscles in there, and that was basically the worst part of the entire surgery. The first 3 days. Now, if I was sitting still or walking around or just, not really exerting myself, it's no big deal. You sitting there watching TV, sitting there in bed, on the couch, wherever, no problem. You're not just sitting there in agonizing pain. No, not at all. But when you try to lift yourself, when you try to get up out of bed or get, out of a laying position and position yourself differently, that was rough. That pain was pretty horrible, but it was manageable. They gave me some Percocet. I took 2 or 3 of them, and then just relied on, basic Tylenol, ibuprofen kind of thing. After 3 days, those muscles, they had basically started to heal at that point. I was able to exert myself with much, much, much less pain. So those first few days are a little rough, but once you get past that, you'll be okay. Now, also, a lot of people I talked to said they just couldn't eat certain things anymore. Well, I have had no issues whatsoever. I have eaten anything and everything I have wanted from the moment I got home, the day of surgery. They said avoid high fat, high greasy foods, but no problem. I've had burgers, pizza, I've had dairy products, ice cream, I've had junk food, I've had Little Debbie snack cakes, I have had bacon, I've had chicken, I've had cheese, I've had just about anything you can imagine. Nothing has bothered me. Not one single thing has bothered me. So I just want you to know there is hope. Don't believe everything you see on the internet saying that you can't have certain things, because everybody's different. So after 3 days, the pain is mostly gone. I can eat anything I want from day one. And now I'm about 5 weeks from surgery, and I'm doing great. I have no pain. I can move around. And I tell you what, within about a week or so, I was actually walking 20 minutes a day on my treadmill. So I was back to being, somewhat active. I've been able to walk 20 minutes every single day on the treadmill. I've been able to lift some light weights, just no problems whatsoever. So if you can go into the surgery knowing that they're going to give you something like Versed to calm your nerves, that'll help take away some of your anxiety. It will help tremendously. And when you wake up from surgery, you will not be in excruciating pain. At least you should not be. You're going to be on some medication to help with the pain. And after those first few days, you're going to be back to normal, hopefully. And hopefully your diet doesn't have to change. You can eat anything and everything you want. Now, for me, my gallbladder was not the source of any super uncomfortable symptoms. I wasn't having gallbladder attacks. But if you are, well, just know that your symptoms are going to be that much better, because once your gallbladder is removed, well, you're not going to have those attacks anymore. So it's going to be a positive thing for you. So I'm just trying to encourage you to know it's going to be okay. Now, I'm going to show you my incisions. So if you don't want to see that, you might want to look away or go ahead and turn this video off. First, I'm going to show you my incisions immediately after surgery, okay? It's not the prettiest of pictures, so I apologize. But this is me laying in the hospital bed in the recovery room, literally just moments after surgery. Now, the top incision, that was the most painful. That was the one I felt the most, and it was basically double the size of the other incisions. That top one is where they pull the gallbladder out from, so it has to be larger. They had the tape, the steri strips on there, and you can see that top hole actually had 2 of those strips on there, and there's a little bit of blood here and there, but I had no issues with bleeding. After about a week, 10 days, the strips started kind of like fraying up and coming loose, so I actually just went ahead and cut the ends of those off with some scissors so they weren't so loose. And then when I got to close to 2 weeks, around that 12, 13, 14 day mark, I went ahead and pulled all of them off, and I was able to clean the incisions. And you don't want to be putting Neosporin or any of those antibiotic creams on those incisions. Actually, what I put on there was Vaseline. I got a little tub of Vaseline, and I just dabbed a little bit on each incision just to keep it kind of moist and to help it heal. Doctor also said vitamin E oil, but I've read that really doesn't do anything. But the point is, you're keeping it moist, you're helping it to heal, and maybe not leave as noticeable a scar. So after a couple weeks, the steri strips are off, everything's clean, everything's starting to heal. There's still a lot of redness. Now I will show you the incisions as we approach almost 5 weeks later. In fact, 2 more days will be 5 weeks since I had the surgery. So as you can see, things have healed significantly. And there's really no there's really no pain anywhere. If anything, the one that is right here, just right in the middle, under my sternum, that was the big incision, and that's the one that I can still feel if I push on it. I don't feel it otherwise, but if I do push on it, very, very slightly tender, but absolutely nothing to worry about. So I've been able to shower, I've been able to take baths, I've been able to walk, work out, everything's been fine. They do say no heavy lifting for maybe 6 weeks, so I'm not lifting any heavy weights, just like little 10-pound weights, and everything's been fine. But one of my biggest worries was my diet. I was really afraid that if I ate the wrong thing, it was going to send me rushing me to the bathroom. I've had no issues. I've had no pain, no stomach cramps. I've had no problems. So just know it may not be as bad as you think it is, and the procedure, the surgery will be over before you even know it. It'll be just quick. You'll be asleep. You'll wake up. It's done. You can start healing. And even those first few days were rough, getting up and moving around, but just sitting in one position, no problem. It's fine. I wasn't in pain, but I admit when you try to get up like that, oh boy, those muscles, you realize how much you use them. So I do hope this video was helpful, and I would love to hear from you if you want to leave some comments on your experience, so we can all just kind of read those comments and get a broader idea of what this procedure is all about. But that's my story, and I hope you enjoyed it. And as always, thanks for watching.